Good afternoon. Welcome to Healthcare Reality. Today's show could be sponsored by the makers of this Lighterderm patch. It's a pain-relieving patch that people put on their back and wherever it hurts. And I'm suffering from a severe case of sacroiliitis, which is lower back pain, and these patches help tremendously. Now, they're not officially a sponsor, but I'm just doing this to illustrate a point because someday I hope they will be a sponsor. Now, for those of you who are new to the show or video podcast, I think I'm an expert in this area, although I certainly do have a lot to learn because I'm 47. I've had Crohn's disease for about 25 years. That's entailed about 150 hospitalizations, 15 major surgeries, and there are pieces of my intestines in about 8 states. So I kind of have a lot of credibility. I actually put everything into a book called Confessions of a Professional Hospital Patient, and it's a very funny real-life account. If you've been watching these videos, I think the book captures who I am, and it offers a lot of tips, and I think those of you out there with chronic illness, even if it's not Crohn's disease, I think you'll relate to a lot of the tips and the experiences that are detailed in the book when you're in the hospital and when you're out of the hospital dealing with health insurance and whatnot. So you could purchase the book at hospitalpatient.com, and there's also a sample chapter called The Emergency Room on the website for you to check out, or at Amazon or any other bookseller. The topic of today's show is when you as a patient believe that you know more about your treatment than your doctor. And that's a little bit of an arrogant statement, so let me preface it with having said all that, you have to have respect for your doctor. And before I get into the details, I just have to share a funny tidbit. When you have a chronic illness like Crohn's disease, you have a lot of downtime. And while I've been going through this sacroiliitis bout, I've had to lay flat on my back. And this is when you watch old TV series, and Miami Vice was on, and I was getting really caught up in it. And then all of a sudden I realized these guys, they were so flashy, Crockett and Tubbs, they drove a Ferrari, a Lamborghini, yet no drug smuggler in 5 or 6 or 7 years ever caught on. Like, hey, when you go to Miami, watch out for those two guys. It just made me laugh. I love the show, it's great, but I thought that was funny. And I think a lot of people with chronic illnesses can relate because you have downtime. Like I said, now with my back, you have no choice. You have to do something. Okay, so when you know more about your treatment than your doctor, I would like to steal from the dog whisperer, Caesar, I think his name is Milano or something. You have to be calm and assertive, but respectful towards your doctor. Doctors have seen it all, particularly if they're experienced. And when a patient comes in, I think they look at you as a coloring book. And over the weeks and the months and the years, the colors get drawn in. They get to know your personality, they get to know your lifestyle, and that helps them treat you. I think it's unfair as a patient to expect a doctor to quote-unquote get you immediately. So if you, and the reason why I bring this up is because I saw this on Twitter this week. A few folks mentioned how it's frustrating that they know more than their doctor about their treatment, and I chimed in saying I know that that's true, but there's a trick to it. You could use it to your benefit, but you have to use finesse and you have to use respect. What I mean by that is, and I'll give you a good example. Yesterday, I somehow managed to go to see my Crohn's gastroenterologist and my pain management doctor because of this sacroiliitis bout. And my Crohn's doctor was great. We started talking, and he has patients, obviously, who have sacroiliitis as a side effect of Crohn's, although he admitted he hadn't seen someone who was in as much pain as I am. Now, that was a learning experience for him, for me. I think he learned that maybe I'm a little crazy, or maybe I really have a really bad case. Over time, he's going to get the answer. I think he knows the answer, and it's not that I'm crazy, by the way. And I learned that I got a bad case of sacroiliitis, but it doesn't surprise me because my Crohn's disease has been bizarre from the start. I once had a delayed anaphylactic reaction that doctors apparently had never seen before to the drug Remicade. So I believe my gut, no pun intended, when there's something wrong with me. But when I say respectful, don't expect your physician to just do what you say he or she should do. They're doctors. They know better than you generally. But specifically, like I said, be calm and assertive. Educate the doctor, whether that's being very clear about what's wrong with you. If you come in complaining about a million things, it's going to confuse the issue. Be very specific. It's also a good idea, I find, to fax your doctors your condition, maybe prior to going in, and certainly subsequently to coming in, so at least on record they can understand that whatever treatment they gave you worked. It's a great way to keep doctors informed, and it will also help you when there's a covering physician on a weekend or whatnot. That's been a big problem for me. I love my doctors. They're great. They've afforded me the opportunity to have somewhat of a normal lifestyle despite the obstacles that we face with a chronic illness. But sometimes on a weekend when you have a problem, you get a covering doctor, and they play by the rules. They're not going to get you, and they figure you could survive for a couple of days. But I find that if I fax to the doctor and they know what's going on with me, I kind of have a little bit more credibility when I could say, look, I think this medication may work best because it's worked best in the past. So, and when you're trying out a new doctor, it's the same thing. Give the doctor time. Let them get to know you. But I will say, you may get to a point where you realize, hey, this doctor may not be for me. And the doctor may be saying to himself or herself that this patient may not be for me. I actually got an email this morning from an old friend who was telling me that he's been watching the videos, and he's a little bit concerned that his son is seeing a great doc, but he's at the age, he's about to go to college, and he really needs to see a doctor who's sort of, not the local great compassionate doc. He needs to see a doctor who's really in tune with what's going on with Crohn's disease and all the different treatments. So I suggested 2 doctors to him. And that's another nuance. You need a doctor who sees the now and also sees the future. So just in summing up, it's okay to know more about your treatment than your doctor. You're supposed to. You live with the illness 24/7. But don't use that in an arrogant manner. Use it in a helpful way so that the physician can over time absorb your knowledge and treat you accordingly. Because you'll be surprised. I mean, with my gastroenterologist, it's been a process, and I've learned so much about him and how he treats people, and I think he's learned a lot about me, that I really believe I am getting the best possible care imaginable. And when you have a chronic illness, I think it's very important to feel as if you couldn't be in better hands. And when it comes to pain management, I feel that way, and I feel that way when it comes to Crohn's. So use your knowledge respectfully, humbly, but in a helpful manner. And don't get frustrated that you know more, because your doctor will get up to speed. Okay? Now, if you have any questions, email me at michaelweiss@hospitalpatient.com, or you could reach me on Twitter. My Twitter name is hospitalpatient. Or leave a comment or subscribe to the videocast. And just one last plug for my book, because my agent told me to. Confessions of a Professional Hospital Patient. You'll laugh. I think you'll cry. I think you'll say, yeah, I totally get that. And it's a quick read. It's a cool book. Just go to hospitalpatient.com or check out Amazon. Thank you, and I look forward to getting any feedback so that I can address issues more specifically going forward. Thank you.